Hi, I'm Bill Bowtell. I'm Executive Director of Pacific Friends of the Global Fund. We're based in Sydney, Australia, which of course is part of the Pacific and broader Asian region. So I've had a long experience now, the last many years, in looking at how the Global Fund works in countries that are close to Australia and very important to Australia, typically Papua New Guinea, Indonesia, Timor-Leste, and then the countries of Southeast Asia, where the fund is well established, in Myanmar, in Cambodia, Vietnam, and so on. So I've seen the difference that the money provided by the Global Fund can make on the lives of ordinary people who would otherwise have no access to life-saving treatments for HIV, to malarial bed nets, to treatment for tuberculosis. This is particularly so in Papua New Guinea, Australia's nearest neighbour. There are 40 or 50,000 people in Papua New Guinea with HIV and AIDS. They have very difficult circumstances. The health system is not good. So getting these life-saving therapies to people in the rural and regional areas of Papua New Guinea is literally a life-saving event. We've got to reduce the number of young children being born in Papua New Guinea. And I'm glad to say that Global Fund supported programs have allowed Papua New Guinea to take big steps to bringing about that very desirable outcome of not having any children born or affected with HIV in that country. So it's a privilege to be associated with the Global Fund. It's a great organisation. It delivers money cost effectively, which is very important in these very straitened fiscal times. It's transparent, it's accountable, it's not perfect. It can be improved, and it must be improved. It must become less complex, more simple, so that that money can get to where it's most needed. But in terms of HIV and AIDS, malaria, TB, we're so much better off now than we were 10 years ago before the Global Fund came along. So if we're going to continue to save lives, to make people's lives happier and better, to make countries healthier and wealthier, then we're going to need the Global Fund. We're going to need PEPFAR. We're going to need bilateral commitments from rich countries like Australia. We're going to need all of those elements to come together to play on the ground and to make that big difference. As Bono said, it's ridiculous that in the 21st century these diseases kill or affect even one person. It's obscene, it's wrong, and we can do so much better. And it's a great privilege to be associated with all the people who make the Global Fund what it is. It's not an entity in Geneva. The Global Fund is you and me, the politicians and leaders who support it, and the people whose lives benefit so much from the life-saving therapies that it helps to provide.